Hi there everyone, it's Dr. Bruce Lambert. I take my mask off so I can make this video, but I just wanted to give you guys and gals out there a nice welcome back to Lambert Chiropractic Health Centre. I'm going to walk you through a little bit of the process when you first come back into the office, just to give you an idea as to how some things have changed. Of course, I'm not going to discuss all the details. A lot of it you've been reading in emails and hearing in the news, but I just want to answer a few questions that I've been getting repeatedly in the last little bit. So you walk in the door, and let me turn the camera around. When you walk in the door, you've got a chair to your right, chair in the front, and a chair way over there. But what I want you to focus on is this hand sanitizer. So please come and use some hand sanitizer, or if you're not wanting to use the hand sanitizer, come on over to the bathroom and wash your hands. So that's the first thing I need you guys to do, is come in and use the hand sanitizer. Jane or Lori at the desk, or it might be myself for that matter, are going to come and ask you some screening questions if you haven't talked to them on the phone or if you haven't communicated this by email. Now I'm just going to read from a list of screening questions that we're obliged to ask. So number one, are you presenting with a fever, a new onset of cough, worsening chronic cough, shortness of breath, or difficulty of breathing? Number two, are you in close contact with anyone with acute respiratory illness, or have you traveled outside of Canada in the past 14 days? 3, do you have a confirmed case of COVID-19, or have you had close contact with a confirmed case of COVID-19? And then 4, do you have 2 or more of the following symptoms: sore throat, runny nose, sneezing, nasal congestion, hoarse voice, difficulty swallowing, decrease or loss of sense of smell, chills, headaches, unexplained fatigue, malaise, diarrhea, abdominal pain, or nausea and vomiting? Or 5, if you're over 65 years of age, are you experiencing any of the following: delirium, falls, acute functional decline, or worsening of chronic conditions? That's pretty much what we have to ask. So if you answer yes to any of those questions, what we require of you is to not come into the office. We can take care of you, but it'll have to be 14 days later. And we do recommend that you call either Peel Public Health or your local health office, or contact your family physician. Now that being said, saying no to those questions, you're good to go. You've used the hand sanitizer, you've washed your hands. Jane or Lori at the front desk are going to quarterback, or basically direct traffic. So we've got plenty of space in the office. We've got the 3 chairs. So in having somebody sit in those chairs, we're not going to have them all full, but it just allows for a nice little dance. So somebody can grab a seat over in a corner and allow somebody to leave. It's going to be well choreographed. There's plenty of space. The office is looking pretty naked. We have our plexiglass shield. You can see how it is all around the front desk area. We have this little desk here. These are obviously to maintain social distancing for staff behind the desk. I know it's been a long time in getting back into the office. We'll give fake high fives in the air. As much as we want to hug everybody and shake everyone's hands, please, we're going to maintain social distancing of that 2 meters or 6 feet. As with the rules you've been hearing for the last little while, washing your hands, not touching your face, and maintaining that social distancing is the key to allowing everyone to move about the office in a healthy and safe manner. In that vein, once you have an idea as to where you're going in the office, it's pretty much going to be going to table 1 or table 2, which has got plenty of space there again. And that's where I'm going to have you. You do not take a clipboard, do not take any paperwork with you. I'm going to come and take that paperwork and meet you at the table. Now the tables themselves have been sanitized. After every use, all the surfaces, the top of the shelf, the lower shelf, the table itself will have been sanitized. I'm washing my hands at my conveniently placed sink right over there. So as I am maintaining a super clean environment, all the horizontal surfaces are being disinfected. One thing I have been asked is, should I wear a mask coming in? I think it's a good idea to wear a mask. It's not mandatory. I'm not going to make it essential that you wear a mask, but you need to keep your hands clean and keep your distance, mask or no mask. I'm going to have a mask on, so don't have any expectation otherwise. You got to get used to this look, I suppose. So we're going to have our table 1 and table 2 in operation. Plenty of space between both of those tables. Again, you don't handle any clipboards or anything like that, and it allows us to move throughout the office. We're going to flow in. We're going to stay away from the front desk, or you'll trip over this little table, and basically try to minimize time in the office. So hands clean, don't touch your face, and we will guide you throughout the office, and you'll be moving with plenty of space to maintain that social distancing. Another question I've had is if somebody in my household is driving me in and they want to help me into the office, we're going to ask both you and your assistant, or if you're coming with a family member for care, we're going to have you move around the office as a pair or as a family. So you'll be coming in. Everyone will be using the hand sanitizer. Everyone will be directed to the table that they need to go, and you'll move as a unit. So that way your collective little bubble is moving throughout the office and maintaining social distancing. I think that's it. We'll probably have updates and so on, but I'm looking forward to seeing everybody in the office. We've made these changes for your protection, for our protection, and I'm happy to get underway in offering chiropractic care. We'll see you soon. Take care.